Hi, my name is Wayne Guerra, and I'm the co-founder and chief medical officer of iTraige. Kidneys are what keeps the chemical balance in your body normal. They're located in your back on both sides, and they look kind of like, a bean. And what they do is clear out the toxins and excess water from your system. So food that you eat is turned into energy, and in that process waste material is made. That's put back into the blood, and then the blood supply that supplies the kidneys is where the kidneys actually take out the excess material that you don't need. Each kidney, and you have two of them, has millions of nephrons, and think of them as little filters. And the blood travels through the capillaries, and it's at that microscopic level that these excess products, these waste products that you don't need, and the excess water comes out. The kidney then turns that into urine, which is then transported to your bladder through a tube called a ureter, and then it's excreted out of the body. The kidneys are very important. If your kidneys don't function normally, then that waste material becomes toxic, and you can actually die if the kidneys fail and you don't get appropriate treatment. Chronic kidney disease is a slow deterioration in your kidney function. It happens over a period of time, and the scary part is you don't see any symptoms or don't feel any symptoms till 90% of the kidneys are already destroyed, or you lose 90% of the function of the kidneys. The two most common diseases that cause kidney failure or chronic kidney failure are hypertension and diabetes, or high blood pressure and diabetes. So it's critically important if you have either of these diseases that you receive treatment on a regular basis. Because if you have your high blood pressure out of control and you're not seeing a doctor or taking your medications like you're supposed to, that is slowly over time destroying your kidneys, but you don't know it because you don't feel any symptoms. So it's a continuum. So it starts and it's very insidious at first, and then you start seeing some symptoms. If there's no intervention, it can continue and become what's called end-stage renal disease. And that's the point where somebody ends up needing either dialysis on a regular basis or a kidney transplant. Dialysis can be given a couple of different ways. One is hemodialysis, and that's mostly the dialysis we do here in the United States, where you see somebody connected up to a machine and it's cleaning the blood. It's doing all the functions of a small kidney. It takes a big machine to do that. The other kind of dialysis, which is more uncommon, but you see occasionally, and you see it more often out of the United States, is called peritoneal dialysis. And that's where a catheter, or almost like a straw, is permanently inserted into your abdominal cavity, and fluid called a dialysate is put into the abdominal cavity, and then it's left there for about 6 to 8 hours, and then it's taken out. And believe it or not, your abdominal cavity filters the toxins out of your system by exchanging it with your blood, so functioning as the kidney. So chronic kidney disease is a very serious disease, and one that we can all prevent if we can treat those diseases that cause it. Kidney transplants are for patients with end-stage renal disease and that decide they no longer want to have dialysis. So it only takes one kidney to do a transplant, and that's why you can have live donor kidneys, right? So the donor can give one of their kidneys, healthy kidneys, and still live a perfectly normal life, and the recipient only needs one kidney. The kidney is typically put into the lower abdomen, and then the ureter is connected to the bladder, and the blood vessels are connected to the large blood vessels in the lower part of your abdomen. They do tissue typing. They'll draw blood and do what's called tissue typing, or HLA typing, to make sure there's a good match. So if you have siblings, there's a 25% chance that you have an exact match, and then there's a 25% chance you have no match. So they try to match the recipient with a donor kidney that has the most what they call antigens, or the best HLA typing. Not everybody's a good candidate for a kidney transplant, because you have to be able to tolerate the surgery. It's a major surgery. You have general anesthesia, you're put to sleep, and there's a recovery period. There's also anti-rejection drugs that someone has to take afterwards, that a patient that receives a transplanted kidney. Those are not without risks either. So, because they depress your immune system, that's how they prevent your kidney from rejecting the donor kidney that you received. So they can cause increased chance of getting an infection. They can make your cholesterol go up, your blood sugar, and actually cause diabetes, and make your blood pressure go up as well. So getting a transplant is really a decision between the patient, their physicians, and their family to make sure it's the best outcome.